I walked into an ultrasound appointment just to look at 40 images of my son's face, and I walked out with a diagnosis of something I had never heard of, congenital heart defect, only to find out that it's the most common type of birth defect.
We were rushed to Phoenix Children's Hospital, and at that point the physicians in the ER could not tell us how much longer she had left. Turns out the reason she was struggling to breathe was because she was born without the right side of her heart. And he tried to explain what my daughter was fighting, this disease, and I couldn't understand. He was using large words: pulmonary, atresia, intact ventricular septum. All we knew was that my newborn baby was going to be getting ready for open heart surgery.
They had me lay just down on one side. They took a very long needle, went into his heart, and ballooned the valve just to 2.5 millimeters. That procedure saved my son's life. Immediately, his heart started pumping again.
These 3D printed models, they change the paradigm of education and language with families. We can convey complex congenital heart disease terminology such as double outlet right ventricle through an easy mechanism. So models like these give surgeons a chance to look at patient-specific anatomy before setting foot in the operating room.
The surgeon and his entire team have held her heart in their hands before they even operated on her. We were floored. Our confidence soared.
It was an incredible visual aid for me to be able to see exactly what was going on with his heart, and then walking away from the procedure, and then today being able to hold hands with an almost 3-year-old toddler. This means the world to me. I can now actually hold his heart in my hand.
He showed us exactly the heart that my daughter was born with, and he showed us exactly what they were going to do to fix it. When he brought us this model, it changed everything. It changed this disease from being a mystery that we couldn't understand and could only hope and pray would somehow work out to an empowering situation where we understood exactly what we were fighting against.
One of our goals at Heart Effect is to not only advocate for these children, because we believe every child deserves a healthy heart, but we want to educate communities and fund programs and research.
There's currently no funding for this kind of work. It's all done through grants. The 3D print lab is changing the way that all of these families and patients will fight this disease.
Thank you.